How does radiation dose affect lung cancer risk? How does the amount of radiation exposure relate to the risk of developing lung cancer? This is a crucial question, especially for those who have undergone radiation therapy or have had frequent medical imaging. Research shows that radiation dose is directly linked to lung cancer risk. Higher doses of ionizing radiation can damage the DNA in lung cells, leading to mutations that may result in cancer. The risk of lung cancer increases linearly with cumulative radiation dose. This means that as the total amount of radiation exposure grows, so does the risk of developing lung cancer. At higher doses, particularly those above 100 millisieverts, the increase in cancer risk is well documented. For instance, studies involving radiation workers and atomic bomb survivors have shown a clear increase in the risk of solid cancers, including lung cancer, as the cumulative dose increases. To put this into perspective, the relative rate of cancer increases by approximately 48% for each gray of exposure, where 1 gray equals 1,000 millisieverts. Even lower doses, such as those from medical imaging, carry some risk, although it is smaller and harder to measure. In lung cancer screening programs that use low-dose computed tomography, the average radiation dose per screening can range from 1 to 8 millisieverts. Over several years, cumulative doses from multiple screenings may reach 20 to 30 millisieverts. While these doses are significantly lower than those associated with high-risk occupational exposures, they still contribute to a slight increase in lifetime lung cancer risk. For example, studies suggest that for every 2,500 individuals screened, one cancer may be induced by the radiation from the screening. The risk associated with radiation also depends on how the exposure occurs. Prolonged or repeated low-dose exposures, such as those experienced in certain work environments, can increase lung cancer risk. However, this increase is generally less significant than that from acute high-dose exposures. Additionally, lifestyle factors, such as smoking, can further elevate lung cancer risk for those exposed to radiation. In summary, the relationship between radiation dose and lung cancer risk is clear. Higher cumulative doses lead to increased risk. Medical radiation exposures, including those from diagnostic imaging, present a small but measurable risk that should be weighed against the benefits of early detection and necessary medical procedures. It is essential to follow radiation protection guidelines to minimize exposure while recognizing the clinical value of radiation-based diagnostics. If you have concerns about prior radiation exposure or are undergoing repeated imaging, it is vital to consult with a healthcare professional for personalized advice on managing your lung cancer risk.